Hi everyone, I'm Ashely Sellers, speech language pathologist and owner and operator of Speech, Language, and Beyond. As promised, I am coming to you with the follow-up video of the previous video in our articulation series called My Child's Speech is Hard to Understand. What is articulation? In that particular video, I give you the total breakdown of everything that articulation is and what it looks like when it is impaired. And so I wanted to, as a way to further that, is to discuss with you, well, so what are some of the commonly misarticulated sounds that we hear when children are developing their communication or their articulation skills. And we're going to start off today by discussing K and G. Now, as we go along, we're going to go back and review some of those foundational things so you can understand what K and G, how it is made, what it sounds like when it is impaired, and different techniques that we can use to try to repair that sound if your child is unable to make it. All right, so let's go ahead and get right into it. So we're going to talk about the place and manner of articulation when it comes to forming the sounds K and G. The place of articulation takes us back to talking about the articulators. The articulators are our tongue, our teeth, the soft palate, the hard palate, and sometimes air can be funneled also through the nasal cavity to create sounds. And so when the articulators come into contact with each other, they create some form of constriction of the air tract or of the air stream from the vocal tract. And where that constriction occurs, it determines what our sound is going to sound like, and it helps to differentiate one sound from another sound. Then once the sound is formed or made, then if there's any type of vibration to the vocal folds, then that will determine whether or not that particular sound is voiced or not voiced. Okay, so the articulators that are involved in producing K and G, which talks about our place of articulation, is the soft palate and the back of the tongue. So let's just say that this is the roof of our mouth where our soft and our hard palate is. This is our tongue. This is our soft palate. This is the back of the tongue. K, k, g, g, k, k, g, g. When they come into contact with each other, that is the sound that we're going to get. Now, when that constriction occurs, there is a complete blockage of the air as these sounds are formed. So let's just say that this is our airstream. When it makes contact, it stops abruptly when these two sounds make contact with each other. And then from there, the sound that comes out gives us K and G. Now, when G is being formed, g, 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 you're going to add the addition of the vocal folds vibrating. That is your voice sound, g, g, g. But that's not going to occur when we produce the k, k, k sound. So as evidence to back that up, as I said in the previous video, if we were to take our index finger and our ring finger and put it here, k, 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 you're not going to get a vibration for k, but for g, 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 you're going to feel a vibration for that sound, okay? And I also attempted to give you guys a somewhat of a diagram or a picture of what this looks like. So this is the back of our tongue here. And then it's touching the roof of our mouth in order for us to get the k, k, g, g sound. All right, so let's keep going. So now that we know how K and G are formed when they aren't impaired and what they should look like normally, we're going to discuss now what are some common substitutions for K and G and other errors that could occur when a child has difficulty producing these sounds. So as we previously discussed, we know that K and G is used or is created by using the back of the tongue coming in contact with the soft palate. But if the child is having difficulty getting the back of that tongue up, sometimes it's easier for them to use the front of their tongue. And so then there becomes a shift, and they're attempting to make a sound that should make towards the back. They're attempting it to make it towards the front. And so now the tip of the tongue comes in contact with the hard palate, and instead of getting k, we're getting t. And instead of getting g, we're getting d. Okay, so that is what I'm attempting to show you here. So instead of doing a k sound, they're substituting it for the t sound. So it is the front versus the back. Instead of getting a g sound, they're giving us a d sound because they're only able to get up the front of their tongue versus the back. So if we were to put that in a real life type of error, instead of being able to say cat, then the child would say tat. Instead of being able to say goat, then the child would say dote. Okay, so that's what it would sound like if it were impaired. If you were to take that in isolation and you would tell the child to say k, 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 k. If they're unable to get the back of that sound, the back of their tongue up to make that sound, then we're going to get t, 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 t. Instead of getting g, 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 we're going to get d, 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 d. Now, I will say this is how it's commonly done, but if a child does not have, let's say for an example, a child can't even make a T sound right now, but all they have is that D, then you're going to get the D for K and G. Or if it's the opposite and the child only has the T, 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 and they don't have the D, 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 then you may get a T for K and G. So it could be interchangeable. Now, there are those instances where the child is just having all sorts of difficulty with being able to manipulate the movement of their tongue. And so because they can't coordinate the tongue at all to go up or to go up in the back or up in the front, then they may totally eliminate the sound. And when you do that, then you're getting nothing for K. You're getting nothing for G. So instead of saying cat, they're going to say at. Instead of saying goat, they're going to say oat. So that's when they're totally eliminating the sound altogether. Now, one thing that I want to bring to your attention, K and G are sometimes harder sounds to teach because they are made towards the back of the mouth. It isn't easy for a child to watch your mouth and see how it is formed. So you would have to rely on things like getting them to listen to the difference between a correct production and an incorrect production. And so you simply do that by getting them to understand, look, yours does not sound like mine. You can record them saying the sound versus you saying the sound and get them to listen between the two. We have an activity that we call auditory bombardment. And that is when you continue to play even though the child can't produce the sound, you give them a listening activity where you're emphasizing the production of K and G. So they realize that they're having to use the back of their tongue. You may do what we call auditory discrimination. And that is when you are pairing the error sound with the target sound. So you're pairing the T against the K because you want them to hear the difference. So you may present them with a word and say, okay, car. Did you hear T or K at the beginning of car? To see if they're able to distinguish between those two sounds when they hear them, as a way to teach them how to make the sounds correctly. So that's just something that you can think about. Make sure you go back and you review this part again, because those are also different strategies that you can use before even getting into an articulation drill where you're getting the child to practice. You guys, let me just say this as a side note. It's like I feel my face being serious as I teach this to you guys, and that's just the nature of who I am, because I really want you to understand, but I'm trying my best to be as lighthearted about it as I can, but that's just how I am when I'm serious about something or when I really want you to understand. So don't let the look on my face make you feel any type of way. All right, so now I want to discuss with you some techniques for correct sound production. Now, for my parents who have no clue of anything about speech therapy or how it works, please do not let these techniques intimidate you. For any of my graduate clinicians or undergraduate students, hey, I'm teaching you something that's going to prepare you for when you have to start doing your clinicals. Because let me tell you, on my first assignment for my first clinical, I was assigned to a pre-K on a base. And you guys, I just didn't have a clue. Like, I read the books. I knew what I was supposed to do, but when you get in that real life experience, you're like, where do I start? What do I say? And so I wish I had known at the time before I started my first session to go and try to look up techniques, but it never dawned in my mind. So a lot of things I had to kind of learn the hard way. So this is kind of giving you a leg up so you don't have to experience what I experienced my first time around. And it's going to take some time to get it right, but keep trying and use this video as a resource because I'm going to attempt to try to link where I found these sheets so that you can go back and print them out and use this video as a guide so you can just kind of have it in your hand and look at it to kind of get a better understanding of what it is that I'm saying, okay? And so our first routine is called the fixed one up routine. This is a routine that I found by Carolyn Bowen in the beginning of my career when I was just wanting more effective techniques to work with my kids. And so it's simply paying attention to small errors and correcting them, okay? And so what that means, her understanding behind this was, even as adults, we make small errors when we're speaking, and we can easily correct them by stopping and paying attention to how we're forming a sound in our mouth and simply starting again. And her assumption is that for some children, it is simple as saying, uh-oh, hold on. There's a small error there. Let's pay attention to that error and then let's fix it up and try it again. So if we come and we look here, we see a picture of a car here. So underneath, it kind of gives you a script that you can use with your child. It says, say to your child, listen to this. If I accidentally said tar when I wanted to say car, it wouldn't sound right, would it? So I would have to fix it up and say car. Did you hear that fixed up one? I said tar, then I fixed it up and said car. So as you are explaining it to them, you're putting emphasis on the error sound versus also putting emphasis on the correct production. And for some children, it may simply be that simple. So they also went as far as to say, listen, this is a T. Does that sound right? Instead of saying T, I need to fix it up and say key. Okay? And you would continue presenting it to them that way and allowing them to self-correct as they go along. Now, I'm not saying that this is going to work for everybody, but it doesn't hurt to try and say, well, maybe if I showed my child that, you know what, you're making a small error that we can fix very quickly, this could be a technique that could simply work by getting them to pay attention. If not, let's look into another one. So then we have what we call the aspiration trick. Now, this is when you are inserting aspiration or air by using the sound between the production of K or G and the remaining sounds within the word. So if we go here and we look at our chart, we see ultimately we want to produce the word cat. But because we know that the child is having difficulty producing the K sound, what we're going to do is first say K by itself in isolation like this. K. And we're going to add H, hat. So you're saying K, hat, K, hat, K, hat, K, at. See, eventually, they are able to eliminate the aspiration by adding the sound H, eliminate it to get cat. So they're going to go from k, hat to k, at, cat, and blended it all together. So let's try the next one. They're going to say the word kiss. That's what we're trying to get them to say. So they're going to say k, hiss, k, hiss. Is. The goal is to get them over time to eliminate the and just be able to say kiss instead of hiss. We want kiss. But I'm telling you, when you're doing it with your child, if they're able to give you hat, hiss, stop there. And just let them get comfortable with the k, 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 k. And over time, little by little, just pull out the and get them to blend it to say the entire sound. So I hope that makes sense. All right, so let's go to our next one. So my favorite, and I love to do these, are minimal pairs. Now, it kind of falls into the auditory discrimination type of thing because you're pairing the error sound with the target sound, because they're saying the D sound, but you want them to say the G sound, but they're making the D sound. So you pair them together so that they can feel the difference between the two sounds, okay? And so the only difference between each word is the beginning sound, but what the words sound like on the end is the same, okay? So for example, we want them to be able to say gate, but instead of saying gate, we're still getting date. So we want them to feel the difference between the two. Now, I personally would put the D first and the G second, because the D is the error sound I want to get rid of, and I know that's what they're able to do. The G sound is what I want them to do, and they either are doing it inconsistently at this point, because I will only present this when the child has shown me that 50% of the time they can get that G sound out, and now they're only forming that D sound out of habit. And so, because I know they still are doing the D sound and they are somewhat able to do the G, but not as consistently, now I want you to feel the difference. I want you to go from the back to the front, from front to back to front, front to back, so that you can interchangeably be able to do both. All right, so I would personally put the D sound first and then the G category last. So that's how I'm going to present it to you. So I would say, all right, here is date. Now let's change the duh and put on the gate. Date, gate, date, gate. If they were unable to get it at that level of blending, I may segment the sound. So I was like, okay, we're going to start with our D sound. So we have D, 8, date. And we're going from that to G, 8, gate, D, 8, date, G, 8, gate, date, gate, date, gate. That's exactly how I would do it in therapy. And then I would also get to the point where I would reverse it for them, because they're going from front to back, where I want them to go from back to front. So I'm going to present it originally how it is here. And so I would say, okay, let's switch it. Let's go from back to front, okay? So we're going to break it down first. g, 8, gate, d, date, 8, date, g, 8, gate, d, 8, date, gate, date, gate, date. And you would do that with the rest of them. So these are just a few techniques that I wanted to present to you. I hope that you're finding them useful, and you can always go back and review if you more in depth. Okay, so here are some other techniques that I kind of already discussed: segmenting and blending. I love to do that. And when I segment a sound, I take a word like cat, and I'm going to detach that K and blend it into the at. So I'm going to say k, at, and I'm going to get them to repeat k, k, at, at, k, at, k, at. Now let's blend it together. Cat, cat, cat. So that's segmenting and blending. Sometimes they can, because we have this thing that we call co-articulation. That when you take a sound like K and you put it next to another sound, sometimes the K may not be made as strongly because of the sound that follows it. So it doesn't exactly sound the same as it would when you're saying it by itself. So it's easier to segment that K first to make sure they can form it correctly and then blend it into the other sound, like segment it and separate it from the sound, and then bring it back and blend it together over time. Okay, and then I highly recommend oral motor exercises. Most times when a child is totally eliminating the K and the G sound, and you may also find that they can't even do the T or the D, then I assume that there is some type of weakness with how fluidly the tongue can move. So we'll do exercises like lifting the tongue up 5 times. So typically I would have them look at me, watch my mouth, and I use my fingers to count. They're going to want to use their cute little fingers to count. And I'm like, oh no, let's put that finger down. I'm going to be the only one to do the counting. I just want you to watch me. So we're going to do an exercise where we curl the tongue up as far as we can. And we'll do that in sets of 3. Okay, I may do another one where I get them to take the tongue and make it go down. Okay, I may have them do one where they're sticking the tongue straight out and bringing it back in. Okay, and then once we do that, I will have them put all 3 of those exercises together. So we would do this. Do another set. Okay, and those exercises over time will help to strengthen those muscles so they can get them in to a sound. Okay, so you guys, I thank you all so much for watching. I really do believe that this video could really be of help to parents, to graduate students, to undergraduate students for any active SLP. So please do me a favor and share this video and subscribe, and please follow us on Facebook and Instagram. And if you have been following me for the past week or so, you know that I am running a 40% off sale on all of my articulation speech therapy materials in my Etsy shop. It is under the name of Speech Language Beyond. Please take advantage of being able to download these activities and create them. You will also notice that when you download most of them, I already have a YouTube video. If you have, I think it's the QR scanner on your phone. If you have that already, you can simply put that up, scan it, and it will take you right to the video that will give you information on how to use your product and how to apply it Thank you all so much. And also, I am doing a interactive child-friendly video on K and G immediately following this video for your child. You can sit your child in front of it. They'll be able to look at it. They'll be able to see me the same way you're seeing me now. And we're going to practice on the K and G sound. I will say that I only use the segmenting and the blending technique in this video, and it's only dealing with K and G in the initial word position, but I think it's a good place for them to start. We start from the sound in isolation all the way up into saying the word in the initial position of a word. Thank you all so much, and I'll see you all in the next video.